The average patient will go to the doctor. They'll sit in the waiting room, maybe wait an hour, maybe two. They finally get their opportunity to go back, and now it's a 5-minute visit. What a letdown, what a disappointment for that patient who was just really willing and ready to spill their guts out, all their symptoms, all their problems, and just get some solutions and answers. You can't do that in 5 minutes. The doctor prescribes a medicine and the patient's out the door. And that's the reality. Most healthcare models, most doctors' offices, most hospitals, that's the way they run. It's broken. You can't give care in 5 minutes. You can't understand a patient's illness in 5 minutes. It's just not possible. That's why I implement the systems I do at Origins Healthcare. Our whole premise is to sit down. It's to take time with the patient. It's to get to know them. It's to understand their history and their background, not just to ask questions for the sake of checking tick marks off on an insurance box. It's to really, truly get to the reason of why the illness exists and why the person is sick in the first place. And once we have that information, once we understand that, now we can dive into some of the other systems that we do. Those systems include highly advanced technological lab tests. These types of tests are different than traditional tests. We're not comparing our patients to other patients. We're not using the same method and the same model of testing. We're using an outcomes-based model. And what that means is each test, each result is based on the patient, not based on 10,000 other patients, which is what traditional medicine bases their labs on. So we use outcomes-based assessments and high levels of technology to really try to ascertain why a person's sick in the first place, combined with a physical examination and a complete thorough history and a relationship. Keyword, a relationship. Doctor and a patient, if they don't have a relationship, then there's no way a patient's ever going to get better. So that's what we want to bring. We want to bring that to healthcare. We want to change healthcare, and we want to change the way that it's done. And we've already implemented that at Origins Healthcare, and that's what we're about. If you look at the paradigm of medicine, we prescribe in this country more medicines than any other country in the world. We're ranked 37th in overall healthcare. Cancer and heart disease and diabetes and autoimmune disease and chronic degenerative pain diseases kill and take the lives and the livelihood away from more Americans than it has ever been, from more people in the world than it has ever been. A new study just published showed that the third leading cause of death in the United States is prescription medication use. Proper use of medications. Not improper use, not accidental overdose, not oops, I gave you the wrong medication, but the proper use of medication. Let that sink in. It's the third leading cause of death. So if cancer and heart disease are the first and second leading causes of death, and prescription drugs is the way that we treat those diseases, and prescription drugs are the third leading cause of death, how are we winning? How are we getting anywhere? And that's the difference I hope to bring to the world through Origins Healthcare. It's the difference in changing the paradigm and changing the model and bringing real healthcare back to the patient.